Hello, I'm Dr. Mathew Bechtold, Associate Professor of Medicine in the Division of Gastroenterology and Hepatology at the University of Missouri-Columbia. Today, we're going to take this opportunity to talk to you about our recent publication in gastrointestinal endoscopy entitled Low-residue versus clear liquid diet prior to colonoscopy, a meta-analysis of randomized controlled trials. This work was a collaborative effort between the University of Missouri-Columbia, the University of California, Irvine, and the University of Illinois, Peoria. At this time, on behalf of all authors, we would like to thank Gastrointestinal Endoscopy for allowing us the time to speak with you. Also, we would like to thank all the authors and all the participants in all the randomized controlled trials that were performed on this subject. Without their hard work and effort, this publication would not have been possible. We all understand the need for colorectal cancer screening. However, in the United States, the adherence rates for colorectal cancer screening is not ideal, ranging anywhere from 60 to 70% of those patients who need to be screened are getting screened by any modality. Of all the modalities, colonoscopy is a popular choice. Many physicians prefer having colonoscopies. However, patients may be a little bit more reluctant. Patients are likely reluctant due to two facets. One, the invasive nature of the test, and two, the need for the bowel prep prior to colonoscopy. We understand as physicians that the bowel prep is essential and critical in a good exam during colonoscopy. A good bowel prep leads to increased adenoma detection rate, increased syncytial intubation rate, and less need for earlier return for surveillance colonoscopy. Over the last 2 decades, there have been many studies performed in an effort to increase tolerability for patients for the bowel preparation. We have used low volume bowel preparations, we have used low volume with an adjunct laxative of some type, and we even went as far as using an over-the-counter laxative mixed with a sports drink to try to improve the tolerability of our bowel preparations for our patients. One facet over the last few years that have been studied is adjusting the diet prior to colonoscopy. Traditionally in the United States, patients undergoing colonoscopy have to endure a clear liquid diet the entire day prior to the test. Many studies have evaluated the use of a low-residue diet, whether it be for breakfast, breakfast lunch, or breakfast lunch and dinner, in place of the clear liquid diet to try to enhance patient tolerability without losing the efficacy of the prep. In this meta-analysis, we evaluated 9 such randomized controlled trials that looked at low-residue diet the day prior to colonoscopy versus the clear liquid diet. We had about 1,700 patients included in this meta-analysis. What we found was having a low-residue diet improved patient tolerability and improved the patient's willingness to repeat the preparation. We also found that having a low-residue diet does not affect the efficacy of the prep as graded by adequate bowel preparations measured or the adverse events. Based upon the studies and the randomized trials that have been done and based upon the results of this meta-analysis, we believe that having a low-residue diet the day prior to colonoscopy will benefit patients and should be offered to all of our outpatients having colonoscopy. By doing this, we believe that adherence rates for colonoscopy may be improved, which is our ultimate goal, is getting these patients screened that need to be screened. Again, on behalf of all authors, we'd like to thank Gastrointestinal Endoscopy for allowing us this time to speak with you today. If you have any questions or concerns, please feel free to email me at bectoldm@health.missouri.edu. This email will also be included in the publication. We'd like to thank you for your time and have a great day.